What is OCDD? OCDD is also called 1, 2, 3, 4, 6, 7, 8, 9 octochlorodibenzoDioxin and octochlorodibenzo-P-dioxin. There is very little information about OCDD itself. It is usually included with a group of chemicals called polychlorinated dibenzo-P-dioxins, PCDDs. PCDDs are byproducts of the manufacture of herbicides, which are used to control weeds and unwanted plants. PCDDs may also be produced in industrial burning processes, in metal processing, and in bleaching paper pulp. Where can OCDD be found and how is it used? OCDD is not used for any purpose. It forms as a manufacturing byproduct of other chemicals. How can people be exposed to OCDD? PCDDs are very common in soil, sediments, and air. Because PCDDs are in the environment, they can build up in animal fat. People are exposed to PCDDs when eating meat, milk, eggs, fish, and related products. You could be exposed to OCDD through breathing OCDD in polluted air, drinking OCDD in water or milk. An infant can be exposed through breast milk. Levels found in water, food, and breast milk are usually much lower than would be considered health risks. Touching, skin contact could cause exposure. How does OCDD work and how can it affect my health? There is very little information about the health effects of OCDD. It has not been studied enough to know if it causes cancer. In one animal study, OCDD did not cause mutations. The health effects of OCDD may be similar to those of tetrachlorodibenzoDioxins, TCDDs, but that is not confirmed. How is OCDD poisoning treated? There is no treatment for OCDD poisoning. A doctor will treat the symptoms of exposure. What should I do if exposed to OCDD? If OCDD gets on your skin, clean the area with mineral oil for at least 10 minutes. Work quickly to remove as much of the OCDD as possible. Get medical help. If you get OCDD in your eyes, flush with water for 20 minutes. Get medical attention right away. If you breathe OCDD, move to fresh air. Get medical help right away. If breathing stops, mouth-to-mouth resuscitation should be performed. If you swallow OCDD, get medical help right away. What factors limit use or exposure to OCDD? Most people will be exposed to OCDD through eating food and drinking water containing it, but those levels are typically very low and therefore not a health risk. Limit exposure by avoiding any activities near hazardous waste sites. At work, reduce exposure by following health and safety rules. Is there a medical test to show whether I've been exposed to OCDD? There are tests that can show OCDD in breast milk, blood, and body fat. Technical information and resources are in the video description.